Hey Diane, it's good to see you.
It's good to see you too, Mark.
Say, do you have some time to talk with me for a few minutes?
Sure. What's on your mind?
Well, I'm having surgery next week, and my doctor gave me an opioid prescription for the pain afterwards. But I've heard opioids can cause substance use disorder, so I'm not sure I want to take them. I know opioids are powerful pain relievers, and they can really help manage pain. But I also know the benefits tend to decrease over time, and depending on how long I use them, they could be harmful.
You're right, Mark. Opioids are best used short-term, and the risks and benefits should be discussed with your provider. If opioids are used long-term, some people can become dependent on them. People who have had negative experiences with opioids in the past should be extra careful.
Opioids are pain relievers, right? So they must work just like other pain relievers.
Actually, no. Opioids affect different pain receptors in our brains than other pain medications. That's why when someone uses an opioid for a long time, they may notice the same amount of medication doesn't ease their pain like it used to. So opioids really should be used as short-term solutions.
I heard opioids are like heroin. Is that true?
Yes, unfortunately that's true. Prescription opioids affect those pain receptors the same way illegal opioids like heroin do. That means prescription opioids can cause opioid use disorder, or OUD, just like illegal opioids. What's worse, long-term opioid use can actually make you more sensitive to pain signals, which makes the risk of OUD and overdose even more dangerous.
I've heard non-opioid medications can be used for short-term pain and are just as effective as opioids. Can you tell me more about that?
Of course, ibuprofen and acetaminophen, or Tylenol, are very common and effective over-the-counter pain relievers.
So it sounds like I have some options.
That's very true. Not only are over-the-counter medications a possible option, but your doctor could prescribe a non-opioid pain reliever. You should talk with your provider and find out what options are available and which one is right for you.
You said earlier that OUD was a possible problem with prescription opioids. Can you tell me a little more about that?
Sure, everyone is different, but for most people, taking an opioid for a couple days is usually not a problem. But when a person uses opioids for a long time, even just a couple of weeks, the opioids can cause clinically significant distress or impairment. We call that opioid use disorder, or OUD.
That sounds pretty serious. How is something like that treated?
Once someone is ready to address their OUD, they would meet with their provider, who can prescribe special medications to help. This is called medication-assisted treatment, or MAT. MAT, along with counseling and other support, has proven to be the most effective way to treat OUD.
Thank you for talking through all this with me. I'm going to talk with my doctor to make sure opioids are the best choice for me after my surgery. And I'll keep in mind that if I do go with the opioids, the lowest dose for the least amount of time is best.
That sounds like a good plan. Good luck with your surgery and recovery.
Thanks so much, Diane. You shared a lot of really good information. I appreciate it.
No problem, Mark. I'll see you later. That's all the time we have for today. Stay tuned for our next video where we'll talk about the stigma surrounding substance use disorder. Goodbye.